About 30% of couples struggling to conceive are eventually handed a frustrating, empty label, unexplained infertility. This diagnosis is usually given after standard evaluations, like hormone blood panels and typical ultrasounds, show a perfectly normal reproductive system on paper. But as this animated cross-section shows, the broad sound waves of a standard ultrasound simply cannot detect subtle, irregular physical barriers, like tiny patches of endometriosis or microscopic webs of scar tissue blocking a fallopian tube. Without direct visual access into the pelvic cavity, finding the true root cause of the problem is impossible. Patients are often left stuck in a cycle of failed attempts and unanswered questions. Historically, doctors had only one way to look for these hidden barriers, an exploratory surgery called a laparotomy. This meant cutting a large, open incision across the abdomen so the surgeon could physically reach in and manually inspect the reproductive organs. It was a major operation that took a massive toll on the patient. It carried a high risk of infection, caused immense post-operative pain, and required a grueling 6-week recovery period just to heal the surgical wound. Advancing fertility care required an engineering solution to this problem. Doctors needed a way to navigate deep inside the pelvis to find the physical blockages without inflicting massive bodily trauma on the patient to do it. That solution is laparoscopy, often called keyhole surgery. It's a minimally invasive procedure performed while the patient is asleep under general anesthesia. Instead of a massive cut, the surgeon starts by making a primary, sub-centimeter incision right at the navel. Through this tiny opening, a needle is inserted to pump carbon dioxide gas into the abdomen. This process, known as insufflation, lifts the abdominal wall completely away from the internal organs. Depending on the procedure, additional small incisions are placed lower down, near the bikini line, allowing the surgeon to insert specialized operating tools. By inflating the belly with gas, the surgical team effectively transforms a cramped, collapsed biological space into a spacious, well-lit cavern where they can safely work. With the workspace established, the surgeon inserts the primary diagnostic tool, the laparoscope. It's a slender telescopic rod equipped with a powerful fiber optic light and a high-definition video camera. As the camera glides inside, it projects a brilliant, magnified, real-time video feed onto operating room monitors. The surgeon can now clearly evaluate the exact condition of the uterus, ovaries, and fallopian tubes. They are hunting for hidden culprits, like dense, sticky, fibrous bands of scar tissue, fluid-filled cysts, or patches of endometriosis. This direct visual confirmation replaces the unexplained label with a specific, identifiable cause. For the first time, the patient's struggle is linked to a concrete physical reality. But the real power of laparoscopy is that it rarely stops at observation. Once a problem is found, the procedure instantly pivots from diagnosis to active treatment. The surgeon slides specialized micro-instruments, like tiny graspers, electrosurgical lasers, and miniature scissors, through those secondary incisions along the bikini line. Working entirely off the high-definition monitor, they can safely cut away restrictive scar tissue, clear blockages inside the fallopian tubes, and precisely vaporize implants of endometriosis. Because diagnosis and treatment happen in the same session, the patient wakes up with the mystery solved and the physical barriers to pregnancy already dismantled. To finish the surgery, the instruments are carefully withdrawn, the carbon dioxide gas is safely released from the abdomen, and the tiny incisions are closed with simple surgical tape or medical glue. Compared to the massive incisions of the past, this micro-recovery is remarkably fast. Patients experience significantly less pain, are usually discharged the same day, and return to their daily routines within a week. Most importantly, restoring the normal anatomy of the pelvis directly improves fertility outcomes. It creates a healthier environment that increases the chances of both natural conception and future in vitro fertilization success. By looking inside and actively removing structural blockages through a few tiny keyholes, laparoscopy gives patients clear answers, renewed hope, and a practical pathway to building a family.